What is a child's core body temperature versus surface temperature? Imagine trying to find out how hot or cold a child's body really is. You might think measuring the skin tells you everything, but there's more to it. The core body temperature is the true internal heat of the child's body, like the temperature of their blood or internal organs. This temperature stays pretty steady because the body works hard to keep it that way, usually around 37 degrees Celsius or 98.6 degrees Fahrenheit in healthy children. To get an accurate idea of this core temperature, doctors often use a rectal thermometer because it measures inside the body close to the internal organs and blood flow. Other places that give a good estimate include the esophagus, bladder, or the area behind the nose, but these are mostly used in hospitals. On the other hand, surface temperature is what you see on the outside, the skin and outer layers of the body. This temperature can change a lot depending on the environment. For example, if it's cold outside, the skin might feel cooler, even if the child's core temperature is normal. Children, especially babies, have a larger surface area relative to their body weight, which means they lose heat faster. This makes it harder for them to stay warm if they are in a cold room, or if they are not dressed properly. Knowing the difference is important. Core temperature gives the real picture of whether a child has a fever or is too cold. When a child has a fever, their core temperature is usually 38 degrees Celsius or 100.4 degrees Fahrenheit or higher. Surface temperature readings, like those from forehead or ear thermometers, can be helpful for quick checks but are less reliable for diagnosing fever because they are influenced by the environment and blood flow to the skin. In everyday home care, using a digital rectal thermometer is the best way to get an accurate core temperature, especially for infants under 3 months old. Forehead and ear thermometers are quick and easy but might not always be exact. Remember, a child's surface temperature can be affected by things like room temperature, clothing, or physical activity. So if you suspect a fever, it's best to confirm with a rectal measurement. Keeping the child's core temperature within normal limits is key to their health, especially when they are unwell. If you're unsure or concerned about your child's temperature, always consult a healthcare professional for guidance. Understanding the difference between core and surface temperature helps you better care for your child's health and respond appropriately to their needs.